I had my penile implant 2 years ago this past January, and I was starting to have difficulties when I was 64 years old. I am now 71, and I read about your procedure in the newspaper, but of course I had to think about it for about a year. And or so, and then finally I decided to come and see you, and that's how it all started. I tried Viagra, and at first, for the first few months, it worked. It worked fine, but then as the time went on, it just had absolutely no effect. I was getting terrific headaches. My face felt flushed, and it really didn't work out because you have to kind of pre-plan it a couple hours in advance, and then if you ate a big meal and then you took the pill, it didn't work. It was a real problem, and I knew that was not the answer. Well, I kind of made up my mind that I had to do something at that point because, you know, you're married and things weren't going too good in the bedroom department. So I came to see you, and I got the examination, and I got the, you know, we spoke about it, and you showed me how the procedure went, and it seemed to be the answer. I mean, it seemed like a simple enough procedure to do, and I could see that it would definitely work. So that's at that moment when I visited you at the office, I decided, yes, I'm going to do it. You first explained to me about the procedure. Then you showed me the whatever it is, the video. The video, yes.
Video clip,
and the video clip was very I can't think of the word, but it was convincing.
Okay.
The video was very convincing. And I knew that I was a candidate at that time.
Okay. Right.
So I decided to go ahead with the operation. I only tried Viagra. But when I came to you, you had given me that injection, which that was definitely a no-no because, you know, sticking a pin in your penis is not for me. So I decided that it would go for the penile implant, which has completely changed my life. You look at life completely different, and you look at women with a different perspective also. Before you felt inferior as a man, because you knew that the best part of you was not functioning. So now that I have it, everything functions wonderful, and I'm able to take on. It's very normal, very, very normal. You don't even know you have it. It's instantaneous. Within a few seconds, you have a beautiful erection. I compared this, I don't know if you would call this an artificial erection, but whatever it is just as good as my erection was when I was 35 years old. The only plus about this is it doesn't go down after a climax. It stays up for as long as you want it to remain up. Completely normal. Completely, the whole thing is completely normal. The climax is just as thrilling as it ever was. There is nothing that I dislike about the whole thing. I would not call it painful. I would call it having a little discomfort. But I think it's very important that you follow the doctor's instructions. And then you won't have a problem. But no, I had no real pain. I had a little discomfort. If I felt maybe a little pain, I would take the pain pill, and it would be fine. When I came back to the office, you gave me instructions, and it worked fine. I would recommend it. I would definitely recommend it to anybody that has an erection problem. It's definitely the way to go. And I've recommended it to quite a few people, and some people have had it done. Some are still thinking about it. But anybody that had it done with my recommendation, of course, they're thrilled. I even recommended it to my own brother. So he's doing fine, yes.
That's good.
Very active.